Welcome to Wellness Wednesday. This week, we're going to be talking a little bit more about how to get rid of back pain without surgery. Now, when it comes to low back pain, I feel like there are so many options out there for treatment. And a lot of times, depending on which provider you start at, you may be pushed into something that may not necessarily be the right conservative option for you, or maybe you don't even have any conservative options offered to you. So what we're going to be talking about today is, number one, the causes of low back pain. We're going to talk a little bit more about some traditional approaches to how you can treat back pain with the traditional medical model, as well as some holistic options that are available. We're going to also talk about some of the things that are missed or how those can go wrong. And then we're also going to talk a little bit more about what things we do in our office to help you get out of pain and actually get long-term relief so you don't have to deal with that long-term, or at least have a bit more control over that low back pain. So we're going to get started. I'm going to share my screen here. And then let's go ahead and get this pulled up. So like I mentioned, today is all about ending low back pain without surgery. So I don't know if you know who I am, but I'm Dr. Andrea Shanowski. I am from Freedom Chiropractic and Holistic Health. We're located in the Metro Center in Peoria, Illinois. And you can give us a call if you have any questions or want to set up a consultation. You can also go on our website, which is freedompeoria.org. So for today, I want to talk a little bit more about my office. So we are a chiropractic and holistic health care center. So we offer a number of different services in our office to help serve you and your family better. We offer chiropractic care, and I do about 10 different styles of adjusting. So for some patients, I have very gentle, barely any pressure style of treatments. For others, I have some tools that I use to assist adjusting, so I'm not having to put a lot of force in. I also have a drop table. And then I also do more of the traditional style of chiropractic too. So that way I'm able to really tailor care to the person and what their bodies and what their needs are so that they can get out of pain. In addition to chiropractic, we also do physical therapy here in the office. So we offer ultrasound, we offer stretching, we also do physical therapy exercises here in the office, and also training sessions. So you have a home exercise program you can work on at home on your own. We also do nutritional counseling, lab testing. We also offer massage therapy, and we also offer x-rays here in the office. So we're able to really, number one, find out what's going on with your problems, come up with a plan and sit down and go over that with you so that you have options and you know exactly what you're responsible for at home, so that we can not only get you out of pain, but get you stabilized so that you know how to take it from there to keep improving. So again, we are located in the Metro Center, and you've got our website already. So let's go ahead and get started. So 31 million Americans report back pain every year. And one of the things that is really interesting to me is when we have back pain, there's many different ways that you can respond to that. So when people kind of brush it off, oh, I did something at work, or oh, I did something in the yard, oh, I just need to do some heat or some ice. Maybe it'll go away. If you have pain longer than 2 to 3 days, chances are you need to get checked out to figure out why that pain is lingering. Now, when we look at doctor's visits in the US, back pain is actually one of the #1 reason that people go to see their doctor. And we're going to talk a little bit more about some of the causes of that later. But when we look at it, that's the #1 cause of disability in the world. So that means no matter where you live, lower back pain or even just back pain in general is a disability cause that prevents people from working, earning their living. We have missed work and things like that for employers. It is a huge issue in the world, not just the United States. Now, the cost of it, so #1, when you have back pain, we are going to have some lost wages. We are going to have medical expenses related to that. You may be missing out on hobbies or time with your family, and that costs billions of dollars every single year in covering those costs. So today what we're going to talk about is, like I mentioned, we're going to talk about some of the causes of low back pain. We're going to talk about some common medical treatments and where they can go wrong, and we'll talk about some non-surgical options and how those work. So most injuries when it comes to back pain are due to overexertion. So when we overdo it, we put extra pressure on the joints, and that can cause inflammation. So that can cause disc swelling, that can cause actual irritation or damage to the disc. And then a lot of times your muscles will spasm to protect that. So if you've been told you've got a muscle spasm in your back and it keeps coming back, chances are you may have injured something and those muscles are spasming to actually protect that issue. So overexertion, so overdoing it, your muscles can kind of get overworked and start to spasm, or they may be protecting a joint injury. Repetitive motions are another reason. So if you're doing a similar motion over and over and over again, we're going to get some wear and tear that eventually can lead to some joint damage unless we're doing some things to reverse that damage or also doing like therapy exercises and things like that to prevent that. Mechanical issues are another one, which we'll talk a little bit more about, but that can be due to posture, that can be due to previous fractures, injuries. Like if you rolled your ankle when you were younger during sports and you never quite got rehabilitated, we never retrained the muscles properly, you may still be walking on the ankle a little funny, and that can cause damage in the ankle. That can also cause damage in your knee, your hip, even your back, coming from that injury in the ankle. And poor posture is another one, so we'll talk a little bit more about that. So I've got a couple pictures here. So I mentioned poor posture, but a lot of times when we are looking down, so whether you're playing on your phone or at a computer, or even just sitting at a desk with your shoulders rolled forward, that rolling forward is actually pulling on the muscles and the joints in your upper back. It's putting pressure on your neck. It's actually compressing your spine, which can lead to joint injuries. Also, sitting at a desk all day, a lot of times, if we don't have proper support or the proper chair or proper posture at our desk, that can cause issues. Two of the most common things I see at workstations are, number one, your monitor is way too low. So if you are sitting at your desk, if you put your hand right here and shoot your hand forward, wherever your hand is, that should be where your monitor is at. Because if you're having to look down, or if your monitor is way too high and you're looking up, that's going to cause pain and issues in your neck. The other thing too, is if your monitor is too far back on your desk, you also may be leaning in to see what's on the screen. So I usually say you want to make sure your monitor is high up and pretty close to you so that you can sit upright with your back resting against the back of your chair, so you're supported all day. You're not trying to hold yourself up with all your muscles all day long. Another thing I see is backpacks. So not just adults, but kiddos too. Kids like to wear those backpacks stylishly on one shoulder. When that happens, though, you're putting a lot of pressure on one side. That can lower the shoulder, twist the spine, and turn the spine, and that can actually cause muscles to be stronger on one side. In some cases, can also lead to curvatures of the spine, and eventually even damage or arthritis that's premature for children. Lifting boxes, another one. So I mentioned those repetitive motion injuries. So if you are doing a lot of lifting, bending, twisting, that can also cause wear and tear in the joints, especially if you're not using your muscles to stabilize, or if you've got muscles that are weaker in some areas. So very important that you are protecting yourself when you are lifting. They always say lift with your legs, but you really do need to make sure you have good core activation, a nice wide stance so that you're spreading the waist in your low back and your hips and pelvis area too. So some common mechanical problems that I see is, I already mentioned some of these. Number one, muscle spasm. So when we overwork our muscles, or sometimes our muscles will spasm to protect a joint injury or wear and tear, we can also have tendon or ligament irritation, more due to overexertion or improper lifting techniques. Joint misalignment. So your joint sometimes can shift out of position, especially if we're overloading the one side. And when those joints move out of position, they're going to put weight unevenly on your cartilage disc, but they can also pinch nerves when that happens too. Disc degeneration. So over time, if you have a lot of wear and tear on a joint, or a lot of pressure on a joint, say you're carrying a heavy backpack, especially if you're in forces, doing training, or if you've been serving for a while, that pressure can actually cause that disc to break down faster. And you lose some of the cartilage. You can also get some dehydration, so it's easier to injure that disc after that. We can also have nerve damage. I mentioned already that when those joints misalign, especially if you have degeneration, the holes where the nerves come out on the side of your spine tend to be much smaller, so it's much easier to have nerve damage. And when you already have inflammation in your joint, your nerves are already going to be oversensitive. It's a lot easier for them to start causing pain signals if there's already inflammation in that area. So if we look at the spine anatomy, we'll talk a little bit more about what's going on here. So you have basically the head itself on top of your spine, and the weight of your head and the weight of all your muscles in your body goes straight down your spine, all the way down to your sacrum at the very bottom. Now, if we have poor posture, our shoulders are rolled forward, your head is going to be forward from your sacrum, and that can cause kind of pressure points throughout the spine where we may have a couple areas that are wearing down faster. Now, if we kind of zoom in on that, you have bones stacked on top of one another. You've got that cartilage disc in between and a hole behind it, which is where your nerves go through. So if we have a joint that's misaligned, like that third one down, it's going to move backwards, pressing on that nerve, and that can actually cause nerve pain. But we're also going to see extra pressure on that joint space, and that can start to cause the cartilage to wear down. Your body will actually, over time, start to build extra bone and form arthritis to help stabilize that area, since it has more pressure on it. So you can see that third bone down, that disc material is red, and you can see it's kind of bulged up front. That's when we have extra pressure on it. But eventually what happens is, because that pressure is kind of off center, you'll see right below that red disc, you have that kind of ledge that's being created, that's extra bone. Your body does it as an adaptation. So arthritis in many cases is actually caused by your body trying to adapt and help when you're wearing and tearing on a joint faster than we should be. So when we look at those nerve compressions or that nerve pressure that we're seeing, that can not only cause back pain, it can cause numbness and tingling, it can cause muscle cramps or even spasms, but those nerves are also attached to your organ system. So we can even see issues with heartburn and reflux. We can see issues with digestion, like constipation. I've also seen some issues with erectile dysfunction and infertility, because nerves going to our sexual organs aren't telling them what to do properly. But a big one is when we have that chronic compression and inflammation, that's going to stress out your body, and your body will start to actually form hormone imbalances as a reaction to that chronic stress and that chronic healing adaptation that happens. Now, when we look at those joints, when we have that extra pressure on them, they're going to start to break down faster, 7 times faster. So when you have a joint out of place, it's going to start forming damage. It's going to start forming inflammation. It's going to start breaking down 7 times faster than normal. So in many cases, when we have abnormal pressure on a joint, we're going to see premature arthritis. We're going to see premature wear and tear. So arthritis is not normal, but it is common. That means a lot of people don't take care of themselves. So when we look at some common treatments that are out there, so typically when you have back pain and you go to prompt care, your doctor, wherever you go, they may recommend doing some ice or heat. They may recommend doing some home care with over-the-counter medication, maybe even using a brace. If you're not getting results with that, they may do an x-ray to look a little bit deeper or even send you to physical therapy. If you don't see improvement with physical therapy, and typically physical therapy works only on the muscles, we don't work on the joints at all. When it comes to physical therapy, it's focused on balancing the muscles and strengthening the muscles to provide more support. But if the joints of your spine are out of place, it doesn't matter how much you strengthen those muscles, you're still going to have a joint misalignment. So a lot of times people that do physical therapy and don't see improvement may actually need some chiropractic care and the physical therapy to get really great results. And that's what we do in our office. We combine those two because we're able to get great results. But a lot of times, if you're not getting results with those things, your doctor may send you to an orthopedist and they may recommend doing a surgery, whether that is for removing a portion of your disc that's bulged, whether that is for fusing bones together, removing a portion of the bone so that the disc can herniate and bulge more without causing pressure on the nerve, whatever that may be, that surgery may be an option for you. Now, what I have found is about 70% of the time, those surgeries for low back pain do fail because we're not fixing the mechanical issue. So if you fuse one bone together and that's now not movable, the joints above and below have to work harder, then they start to break down. It becomes a cycle. Typically, I find that if somebody has had a mechanical issue and we do a surgery for it, we never fix the mechanical issue. So a lot of times their pain comes back in a couple of years. They may need another surgery in a couple of years because we didn't stabilize the joint properly. And a lot of times in our office, we do find that people that have already had surgery, we are able to help them in our office by providing different types of treatments that are available. So let's talk about those. So some non-surgical options. So one of the things that we do in our office is obviously chiropractic care, but another thing is called Flexion Distraction. And this is such a neat thing. So you may have heard decompression before. Decompression is typically a machine that you are going to put straps in a kind of like a girdle around your chest, and you're going to put another one in your lower back. And then those girdles attach to a machine that basically will stretch you out, kind of like the old school torture chamber racks. And what that does is basically, as we're opening up the disc, it changes the pressure in the actual disc itself, and it can bring bulges in. The thing is, what I found is a lot of times decompression is not covered by insurance, so it can be very expensive to do treatments. Also, if the decompression table that you are using doesn't have the option to change angles or pressure, sometimes we may not be doing a specific opening on the joint that needs help. We may be just stretching all of them out. So it's very important that that's very specific. So in my office, I use something called Flexion Distraction. So as you can see from this picture, the chiropractor actually has the woman laid on the table. The bottom part of the table actually will bend down, and there's a bar he's using where he can actually stretch out that lower back to help provide that pressure, and he can place his hand exactly where we need to put the pressure. The other great thing about this table is we can also do side flexion. So instead of just going straight up and down, it can also twist to the side. So we can actually target one side of the disc if there's a disc bulge or herniation to try to start reducing that. Now, this treatment is absolutely amazing for people that have mild to moderate disc bulges or herniations or degeneration, or people that have some facet damage. If your disc herniation is moderate to severe, or if we have any disc protrusions, it is not always very effective. Typically, I find we can sometimes see relief after that first treatment, but typically once we do about 10 treatments, we see a huge improvement. Now, I do this along with adjusting, so this is not an additional charge. It does get billed to insurance as part of your adjustment. So it is a way for us to basically offer that decompression, but it's all manual by hand so that we can get some options for you there. Chiropractic care obviously is number one. We have to make sure the bones are aligned, but we can also add in that flexion distraction to help out as well, making sure that we are able to open up that disc space and try to reduce some of the bulge or herniation, or even bring some fluid in there so it heals faster. Now, when it comes to flexion distraction, I already mentioned the table. So you can see there are little straps around her ankle. Yes, sometimes we do have to strap you in to get a really good stretch. Don't worry, we let you out when we're done. But the great thing about that is when we think about that disc, your disc is kind of like a Chinese finger trap. So when we are pulling on that disc, it is actually pulling fluid in. It's pulling disc herniations and bulges back in, so it can actually reduce a disc bulge or herniation. Like I said, it is more successful with mild to moderate disc bulges, but that's going to help by creating a negative pressure environment. So it pulls fluid and nutrition in the disc, as well as helping to reduce that disc herniations. It is very effective. Like I said, I have some patients see almost immediate improvement with one treatment. Some to take a little bit longer, especially if there's a lot of damage or if they have had some pretty severe arthritis in that area. So for this month only, so in June, we are offering a free back pain consultation. So if you or someone you know has been dealing with back pain, we are able to offer that back pain consultation free of charge to them. So that is a $150 value. I only have 5 spots available, so you do have to contact me as soon as you want to reserve one of those. So you can request an appointment either by going to our website, freedompeoria.org, or calling us on the phone, 689-6200. So have a great rest of your day. Hopefully you learned something. And again, that free back pain consultation is June only. So if you see this video, make sure you call us or go on our website to get that appointment reserved. We only have 5 spots available in June that I'm giving away for free, so that I can help people with back pain this month, because I know a lot of us want to get outside. We want to play with our kids, our grandkids, get back to playing sports, go on a vacation and enjoy it without dealing with pain. So I want to make sure we are able to help you. You can do that this summer and enjoy the rest of your year. Have a great rest of your day, and hopefully you learned something today. Join us again next week for Wellness Wednesday. We're going to be talking about how to stop acting your age. Now, we're going to take a lighthearted approach to this. There will be lots of jokes, lots of funny things. So if you want a good laugh, make sure you join us next week on Wednesday at 5 o'clock. Have a great day. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5.